if the drug companies could bottle mindfulness, they would sell it for enormous amounts of money, you know, but they can't bottle mindfulness, it's free. We really don't know what it means to be human or even what it means to be alive. But by investigating, we can actually live our way into the opportunity to be fully awake while we have the chance. And that is what mindfulness and that is what the Dharma is really about. Who are you? The most honest answer is, don't know. What Sansanim used to say, don't know. And that not knowing is a form of awareness. Awareness isn't just awareness of what you know. Awareness is your awareness of what you know you don't know. And there's enormous liberation in that. Freedom and insight and also potentially compassion for other people and for people and the planet that's suffering.
You worked in a hospital while researching molecular biology, and after 10 years in the hospital, you introduced meditation to the hospital. Was there a specific moment or reason that led you to believe that introducing meditation into the hospital could be beneficial for patients?
Okay. I only worked for 3 years in the laboratory at UMass. That's how I got to UMass. In 1976 to 1979, I worked in a laboratory in the anatomy and cell biology department. And I went there because the man who offered me the job in his laboratory said I didn't want to really work in the laboratory. But he said, well, if you come, I will let you teach anatomy in the gross lab, you know, with dead bodies, because we teach the medical students anatomy by cutting into dead bodies, taking them apart. It's called gross dissection. And since I was a yoga teacher, the opportunity to do gross dissection and look at the anatomy of a human body was like too much to pass up, so I said yes. So I worked in the lab for 3 years. And in that last year, which was 1979 in the spring, I started to go around and talk to doctors in the hospital, because I was in the medical school, separate from the hospital. The buildings were connected, but separate. I went and I started to ask doctors, what percentage of your patients do you feel you help? This again in 1979. What percentage of your patients do you feel you help? And they said, and I asked the chief of the primary care clinic where they see everybody. I asked the chief of the pain clinic where they see people with very severe chronic pain conditions in the anesthesiology department. And then I asked the second in command in the orthopedic clinic where they deal with broken bones and things like that, and a lot of pain. And they all said the same thing. They said, well, maybe they help 15 or 20% of their patients. And I said, oh my God, what happens to the other 80 or 85% of people? And they all said, well, they either get better on their own or they never get better. And I said to them, well, do you think it would be valuable to create a clinic that's kind of like a safety net? A safety net, and it catches people falling through the cracks of the healthcare system, where the drugs aren't helping, the surgery isn't helping, they still have pain, they still have anxiety, they still have depression. And we train them in these Buddhist meditative practices without the Buddhism, you know, pure Dharma, universal, and see what happens, just as an experiment, whether they get better. And what happened was that the average chronicity of the diagnoses of the people we were being sent in the first few years was like 8 years. They had their problem for 8 years, no satisfaction or minimal satisfaction. And then we followed them for 4 years, the chronic pain patients. And they got noticeably better in 8 weeks, no drugs, just meditation. And then we followed them up for 4 years afterwards. And the more they kept up the meditation practice, which most of them did, the more their relief from the pain extended out over 4 years. So that was a real demonstration that medicine needs to be more participatory. We need to ignite passion in the patients for their own potential for healing and teach them methods that would be really, scientifically validated to help them do that. And then you had asked me, I may be skipping ahead, were there some studies that you wanted me to talk about that I find particularly confirming of this orientation? And I think the most important one in terms of the acceptance of MBSR is that it has been recently shown that 8 weeks of MBSR for people with anxiety disorders reduces people's anxiety at least as much as the drugs, the Lexapro, which is the major drug for anxiety. So now if the drug companies could bottle mindfulness, they would sell it for enormous amounts of money, but they can't bottle mindfulness, it's free. But if it weren't, if it was a drug, this would be on every front page of the newspaper, okay? Mindfulness-based cognitive therapy that my colleagues in England and Canada and Wales developed in the late 90s, they have shown in many, many clinical trials, it's at least as good as antidepressant medication. So both for anxiety and depression, which are the two major psychological diagnoses of people, I'm sure in Korea as much as in the United States, the meditation works at least as well, if not much better, and with no negative side effects, as the medication.
How did you guide the patients participating in MBSR who lacked the ability to observe their negative emotions objectively or had a severe attention deficit?
Many people with attention deficit disorder benefit from mindfulness training because mindfulness is all about attention. So the more you exercise the muscle of attention, the better you get. So this turns out to not be a big problem for people with attention deficit disorder. In fact, they benefit from exercising the muscle. They get better at being attentive, and they get better at being aware of when they're not attentive. And that awareness is the same awareness as mindfulness. So that when you know that you're not being aware, in the next moment you're aware. That's what the awareness of awareness can bring you. We don't guide them in any kind of special way. They participate in the program like everybody else. And because it's about training in attention and the awareness that arises through attending, they benefit as much as anybody else. The one thing I'll say is you have to practice. You can't just come to the classes and listen to what everybody else is saying, or you have to actually exercise the muscle yourself. If somebody else is exercising the muscle at the gym, you don't benefit unless you go to the gym too. So that's really the answer to that question.
The Thai Buddhist master Ajahn Chah, do you know Ajahn Chah?
Ajahn Chah.
Yeah, Ajahn Chah said that through the practice of the mindfulness, when subject and object are permanently separated, one reaches a state of peace. Typically, ordinary people find it difficult to break free from suffering because they tend to identify their thoughts, emotions, and experience as the same as themselves. How can one most effectively separate the subject and objects?
Well, the beauty of awareness is that you don't have to separate subject and object. Awareness actually is non-dual. So you apprehend that we make subjects and we make objects. We make me, myself, and we make the world. There's no separation between myself and the world. So this is a very dualistic orientation. And in English, the language itself has a way of helping us teach people the non-dual approach to their own minds. Because we can say, breathing, or lifting, or knowing, or attending. These are all what are called present participles in English. I don't know whether you have that in Korean. This form of speech where I can say breathing, or say to a group of people lying on the floor or sitting, breathing in. I'm not saying you breathe in, okay? Just say breathing in. So there's no subject, and there's no object, there's just breathing. Mm-hmm. So it's a very convenient way to use the language when a language can do that for you, because if you think I am breathing in and I am breathing out, then you make a separation between me and the rest of the world. And that is kind of like, wait a minute, you are the world. You are part of the world, a very mysterious part of the world, but still, you're part of the world. And the more you create separation, the more, for instance, we don't treat the world like a really valuable commodity because it's not me. So I can pollute it if I want to. This is very wrong thinking. On a small level, it may not harm anything, but on a planetary level, it's harming everything. So we need to transcend subject-object duality, and that's exactly what the meditation practice does. And by the way, this is not a criticism of Ajahn Chah, who is a great meditation teacher, but that tradition, the Theravadan tradition, has a tendency to emphasize the instrumental aspect of things. That is a kind of a dualism where I'm ignorant, and if I practice really well, then my ignorance will go away. So it's like ignorant and then wisdom, separate. In the Chan and Zen and Psalm tradition, no separation between ignorance and wisdom, between this and that. It's like no subject-object dualism. And this is one of the great gifts of the Mahayana and Vajrayana traditions within Buddhism that is so fundamental to Korean Buddhism, is that there's no subject-object. That's wisdom. When you transcend subject and object. So then there's only pure awareness. This comes, that goes, that comes, that goes. And there's only pure apprehending. And then that question of who am I? As San Sanim used to say, if you open your mouth, you're going to be wrong. Open your mouth and you're wrong, is the way he put it. Because as soon as you say, I'm Jon Kabat-Zinn, well, on a kind of ordinary relativistic level, yes, I'm Jon Kabat-Zinn. You're not Jon Kabat-Zinn, you're somebody else. I'm Jon Kabat-Zinn. But on an absolute level, there's no separation between you and me. We're all human, like waves on the ocean. Each wave doesn't say, hi, I'm me, because immediately they're going to go back into the ocean. And this wave, oh, I don't like that wave. That wave doesn't have the right shape, but I have a wonderful shape. This is ignorance, because it's the water. The water essence is the essence of all waves. So the separation is an illusion. And we haven't begun to understand, even on a biological or physical level, what life really is on this planet. Because insects and birds and and fish have all sorts of sensoria that we're just beginning to discover that we don't understand at all. And it's true for us too. Awareness until very recently was like, nobody ever thought about awareness. No one studied awareness. It was like impossible to study it scientifically, but they study attention. And attention's interesting, but it's not as interesting as awareness. But you have to have a whole other level of investigation and technology to understand awareness. And meditation, taking your seat in meditation, is its own kind of laboratory. You are the scientist now of your own experience, and asking questions like, am I breathing in, or is it just breathing? Because, yeah, conventionally I'm breathing in, I'm breathing out, but I do it in my sleep. So I can't say I'm doing it. If I wanted to stop breathing, the body would not let me stop breathing for long. I can hold my breath, but I can't commit suicide by holding my breath. Because there are larger issues here. And so we really don't know what it means to be human or even what it means to be alive. But by investigating, we can actually live our way into the opportunity to be fully awake while we have the chance. And that is what mindfulness and that is what the Dharma is really about. And then we don't do it for ourselves because we understand that the story of me, my narrative about who I am and great meditator, great scientist, great whatever, great journalist. No, that's just a narrative. It's a fairy tale. Who are you? The most honest answer is, don't know. What San Sanim used to say, don't know. And that not knowing is a form of awareness. Awareness isn't just awareness of what you know. Awareness is your awareness of what you know you don't know. And there's enormous liberation in that, freedom and insight, and also potentially compassion for other people and for people and the planet that's suffering.
No I, no you, no separation, just doing. As Sungsan S님 said,
that's right.
Just don't know.
Just don't know. Yeah, but to know you don't know.
MBSR can be highly beneficial for people who experience daily stress. This stress might come from a constant craving for wealth and success, neglecting oneself and the family in pursuit of a success-oriented value system and excessive desires, but modern people cannot help but work hard to make ends meet. What advice would you give to modern people who find themselves navigating between desires and rest?
Every moment is your life. So to make a distinction between work life and family life is kind of okay, but it's not the full story. So when you're at work, give yourself 100% to work. When you're at your family, give yourself 100% over to family. It's all one seamless whole. So in that sense, yes, we all need to make a living. And this is called in the classical Dharma tradition, right, livelihood. It's one of the foundations of mindfulness, one of the Eightfold Noble Path. So when life itself becomes practice, there's no separation between this and that. And you are 100% available as appropriate to whatever the conditions demand at the moment. And that is meditation in action. That's embodied wakefulness brought to all your moments in life.
Oh, very excellent answer. Yes. Not sure help working and help rest. No, just 1% working, 100% working, 100% rest.
Yes, at all times. So you're at rest at work.
Yeah.
So I'm comfortable at work. Yeah. That transforms work. I mean, people talk about work, stress at work. And of course, there's stress at work. But how you are in relationship to it can make all the difference. So it's not like stress reduction means making no stress, then you'll be happy. No, this stress is the same as life. You know, there's no life without stress. The challenge is always, how am I going to be in wise relationship to it? And that's where, again, exercising the muscle. So then even something like that happening is part of one's practice. One inquires, don't get aggressive, but we sort of try to find a way to be most comfortable with the situation. Sometimes you can't change it. You've got wars going on with people killing each other and bombing hospitals and, you know, killing people on both sides of something in the Middle East now. Who's right? Who's wrong? These things go back hundreds of years, thousands of years. And we need to find a way for human beings to not kill each other out of fear that the other's going to kill them. And this is, I think, the curriculum for the world at this moment, for humanity at this moment, is to learn to tame the mind in such a way that we govern ourselves to minimize harm and suffering and killing and pollution and maximize well-being. We can do it. We're brilliant. We're incredibly intelligent. But sometimes when we take ourselves too personally, the story of me as being Israeli, or the story of me as being Jewish, or the story of me as being Palestinian, or the story of me as being Russian, or the story of me as being, Ukrainian, or whatever it is, the stories are only part of it. The me is much bigger than the stories. So we have to investigate how we live with each other, because otherwise it's like in your body, the liver and the heart, they don't like each other. The liver cells think, those heart cells, we don't like the way they look. And they're always contracting, and they're just like, contracted. And the heart cells say, we don't like those liver cells. They have a terrible color. They don't do anything. They just sit there. Not true, but that's their view. So if you imagine your heart and your liver go to war, how long are you going to be alive? It's the same with nations. If we care about humanity, and now because we can destroy so much of the planet with nuclear war or with the kinds of weapons of mass destruction that we have, we're basically killing the earth and killing future generations before they're even born. We could wake up to that. We could just say, we need a new kind of lawfulness. We need a new kind of dharma. The root meaning of the word dharma is lawfulness. So we need a lawfulness that actually recognizes our own tendency to create harm and then make it against the law to create that kind of harm. There are laws of war. They are broken. But what we need is laws of peace. And we need to give up war. War is terrorism. All war is terrorism. It doesn't matter what side you identify with. Ultimately, you're killing mostly innocent people. Babies, women, old people. It's insane. But we all think, we don't like it, but it has to happen. No, it doesn't have to happen. So this is kind of, again, as I was saying, mindfulness or compassion for the planet, not as a good idea, but as an active way of intervening to stop violence and favor, privilege, the potential for all human beings to flourish. And that's what mindfulness is all about. I don't know how it is in Korean, but when we use the word mindfulness in English, it's not really such a good word, because in all Asian languages, I've been told the word for mind and the word for heart are the same word. Is that true in Korean? So when you hear in English the word mindfulness, if you're not hearing simultaneously heartfulness, you're not really understanding it. So it's not like mindfulness is over here and compassion is over here. They often say, two wings, one bird. Okay? The wing of wisdom, the wing of compassion. But actually what is most interesting is one bird. Okay, one bird. And when we bring mindfulness and heartfulness together, that's the true mindfulness, and it's already liberative. And as I was saying with Dharma, if the Dharma is really the lawfulness of the universe, like Tao, and not just the teachings of the Buddha, but they're the same, then when we learn to inhabit our true humanity, we will default to peace rather than to finding enemies and then always being at war. And I know that in Korea, of course, your whole country is separated, and has been for a very long time, since I was a little boy. I remember the Korean War and the devastation and destruction there. And I visited some of the U.S. Army when I was there, because now the U.S. Army is into mindfulness, even in Korea. But now South Korea is a thriving society, and look at North Korea. I mean, it's a hell realm. So there's no clear route to kind of unification or to but that's what we need to put our energy in, because everybody's suffering at the hands of a small number of people who have all the money, who have all the potential political power and control. And we need to diagnose that illness and find treatments for it.
Thank you so much, your compassion.